My area of interest is in suicidology, which is the study of suicide. Broadly, I'm interested in prevention, intervention, and postvention, which is helping families who've had a loss to suicide. Postvention has increasingly embraced suicide attempt survivors, so people who have made their own suicide attempts or people who care about people who've made suicide attempts. About 40,000 Americans die by suicide every year. Just for basis of comparison, that's more than double the number of Americans that die by homicide, and it's even more than the number of Americans that die from breast cancer. Unfortunately, suicide research really just isn't funded as well, and so we haven't been able to figure out how to stop that number. I started out my career as a clinician, and so I had that one-to-one interaction with people. And what I realized as I got into doing research with people who are survivors of suicide loss is that we just don't know how many of them there are, what they need, if the services that are available even work for them. People don't want to talk about suicide. When it's not a conversation starter, oh, you do suicide research, let me tell you about my family member, is a conversation ender, because people really don't know how to react. That has also led, in some ways, to the field not being as well funded as it should be. There's been some great advances. I think NIH is really starting to think about this. The DoD is. The National Action Alliance for Suicide Prevention has been a lovely public-private partnership, but the research just hasn't been there yet to be able to figure out how many people there are and how to best help them. For my entire career, and even before I got into this field, we've been confronted with the statement, for every person that dies by suicide, 6 people are left behind. And that 6 was not empirically based at all. It was based on Ed Schneidman, who was the father of modern suicidology. Someone asked him once, so these people who are left behind, how many people do you think are affected? And he thought about it and said, probably 6. What we really wanted to do is doing this big epidemiological study that was funded by the Military Suicide Research Consortium. We realized that we had an opportunity to have some actual numbers. The people that are affected by suicide are probably a lot more than 6. And here's some data that can change the way people in the public, people in public health, people who fund research like this can really think about it differently. At least 25 people who are probably profoundly in need of some sort of intervention or support or services, then that's a really big number of people that need first research to figure out what it is they need, interventions to help alleviate their suffering. And then we've also found that people who know someone and are deeply impacted by someone that dies by suicide are themselves at risk for suicide. More people have died by suicide who are members of the active duty military than died in combat or operations in Afghanistan and Iraq in the current engagements there. So the problem became of utmost importance to the military to figure out, why is this happening in this group of people who historically have had relatively low suicide rates? The consortium is funded by the Departments of Defense as really a way of thinking about the problem of suicide in the military, but also of thinking about novel ways of confronting the problem, so that we were able to do a study to show if there were differences between veterans and members of the community. We ended up with 900 veterans who had served in the U.S. Armed Forces and about 800 members of the community who had not served in the Armed Forces. For me, the not 6 misconception is a big one, because when we think about losses to suicide, what's really spurred me ahead in continuing to do this is all the time I hear from people, oh, I looked you up, that's what you do, let me tell you about my brother who died by suicide. Even before I went to give the talk in which we introduced the not 6, I was getting my hair cut and talking to the person cutting my hair about it, and he said, you know, my dad died by suicide when I was 4. I had no idea. We don't talk about it, we don't ask. There's actually a lot of evidence that people who are bereaved by suicide are treated differently, so they don't get the kinds of support from community members that other people who have other kinds of losses get. And that 6 numbers really restricted us, because even if family members get support, when we think about on a college campus when a suicide occurs, the hallmates, the fraternity mates, kind of all the people that might be affected. And the military, similarly, is like a college campus because you have lots of people who are living and working very closely. They don't necessarily have those family relationships, but the death of someone who's not related to them can have even a more profound impact. It's different than most professional organizations in which I've been involved because it involves professionals, so clinicians, researchers, people who do prevention or crisis work, but it also has loss survivors and now attempt survivors. People kind of refer to the annual meetings as family reunions because you get to know people there in a very different way than typical professional colleagues. But it means that all of the work that I present is going to have not just other scientists, but family members who've lost a loved one or people who have lived with their own suicidal behavior in the audience. And so for me, that makes it so much more relevant.
Bye.